Hi, so today I'll be talking about mental health during the COVID pandemic. And I think it's especially relevant this month because May is actually Mental Health Awareness Month. So that makes it even more relevant. So today we're going to be going over what is mental health. We'll go over what it encompasses, different types of mental disorders, and then COVID's effect on these types of mental disorders, and then ways that we can take care of our mental health. So to start off, what words do you associate with mental health? What do you first think of when you hear those words? And so these are some words we've received in the past when we've presented. Some of them are anxiety, disorder, depression, stress, emotion. And I think these are all words that definitely relate to the umbrella term mental health. So mental health refers to our emotional, psychological, and social well-being. It can affect how we feel, think, and act. It can also affect how we react to certain situations. Some people might react with stress and denial, while others might react with fear and anxiety. Your reaction tends to depend on your mental state. So it can affect people's relationships. Challenges with mental health can affect relationships, your daily life, and even your physical health. So what are some real life examples of ways mental health affects these? So some ways with relationships, let's say you react to mental health challenges with stress. Sometimes that can harm relationships if you act on impulse. And it can even affect physical health. Sometimes if you don't feel like getting up out of bed, if you don't feel like taking care of your mental health, it can start to affect your health and your diet, you going outside, getting exercise, and then these can all kind of start a ripple effect, which will affect your physical health. So now we'll go over, I think, 4 types of mental disorders. So they're actually very, very common mental disorders. In fact, about 1 in 4 adults suffer from a diagnosable mental disorder in a given year. That's 25% of people. I think because that number is so large, this is definitely an important issue to talk about and to address. So different types of mental disorders include anxiety disorders, mood disorders, eating disorders, and obsessive compulsive disorders. So these are all just umbrella terms. There's smaller subcategories that fall under each of these terms. And we'll be going over these 4, although there are much more other mental disorders, but these I feel like are the most common and good to know about. So to start with anxiety disorders, people with anxiety disorders respond to certain situations such as personal health, work, social interactions, and everyday life with fear and worry. So they tend to show signs of reacting to these situations physically, such as rapid heartbeat or sweating. So this is diagnosed if the person's response is not appropriate for the situation. For example, if the person cannot control the response and if it's kind of out of proportion to how a normal person would react to the situation, or if the anxiety interferes with normal functioning. So the different kinds of anxiety disorders, remember I talked about how anxiety disorder is an umbrella term and there are subcategories that fall under it. That includes generalized anxiety disorder, panic disorder, phobia-related disorders, social anxiety disorder, and separation anxiety disorder. So some of the symptoms are being easily fatigued, muscle tension, difficulty falling asleep, being irritable, having difficulty concentrating, and difficulty controlling feelings of worry. So the next type we'll talk about is mood disorders. These can also be called affective disorders, and they involve persistent feelings of sadness or periods of feeling overly happy. So it varies and it's kind of uncontrollable. So mood disorders are also diagnosed when a person's mood tends to fluctuate from extreme happiness to extreme sadness. And it happens often and almost with no real cause. So mood disorders can interfere with one's ability to function because they tend to be inconsistent with their circumstances. So the most common types of mood disorders are depression, bipolar disorder, cyclothymic disorder, and seasonal affective disorder. So some of the symptoms include irritability and hostility, an ongoing empty or anxious mood, changes in sleep pattern, and changes in appetite or weight. So the next type we'll talk about is eating disorders. So they involve extreme emotions, attitudes, and behaviors, including weight and food. So it's kind of uncontrollable thoughts that you have about eating and about your own weight. In severe cases, eating disorders can cause serious health consequences, and many can even result in death if left untreated. So these are one of the mental disorders that can really affect physical health. Even though it does affect your mental health, it can even go on to affect your physical health. So some of the common types of eating disorders include binge eating disorder, bulimia nervosa, pica, rumination disorder, and avoidant/restrictive food intake disorder. So some of the symptoms include preoccupation with food, calories, carbohydrates, fat grams, and dieting, so kind of an obsession with everything that you're consuming, extreme mood swings, uncomfortableness eating with others, noticeable fluctuations in weight, so that means going from heavier to thinner, withdrawal from usual friends and activities, and skipping meals or taking small portions of food at regular meals. And the last one we'll talk about is obsessive compulsive disorder. So people with this disorder struggle with constant intrusive thoughts or fears that compel them to perform certain rituals or routines. They're intrusive thoughts, so they are not controllable. The disturbing thoughts are called obsessions, and the rituals are called compulsions, thus obsessive compulsive disorder. Oftentimes, when trying to ignore or stop their obsessions, people only increase their stress and anxiety. For this reason, OCD is often referred to as a cycle that is really hard to stop. You try to stop the obsessive compulsive disorder and it increases the stress and anxiety, which then continues into the circle of starting the obsessive compulsive disorder. So it's kind of like a cycle. Some of the symptoms are needing things orderly and symmetrical, unwanted thoughts, I think that's the biggest symptom, doubting and having difficulty tolerating uncertainty, following a strict routine, silently repeating a prayer, word, or phrase, and demanding reassurance.
So next, we're going to go into a bit of COVID-19's effect on these mental health disorders. So if we go to the next slide, before we start, just consider for a second, how has your mental health changed the past year? So really reflect on that. Consider, have the people you talk to changed? Do you have the same hobbies and interests? So on the next slide, here are some of the past answers we've received. Some people have said they definitely don't have a lot of time for their hobbies. They feel more stressed. They don't talk to their friends as much. Overall, there's just a general consensus that everyone's mental health has declined this past year. So this is actually shared across the nation, with 42% of people reporting symptoms of anxiety or depression, an increase from 11% the previous year. This is a huge jump. So that really makes you wonder, like, why did COVID have such a profound effect on mental health? So on the next slide, we can see that basically people are facing new challenges that can be stressful and overwhelming. We really had to adapt to a lot of new virtual platforms. We've also had to have the added worry of making sure our loved ones are safe, especially our elder relatives. At the same time, we do have to comply with those stay-at-home orders. So there's a lot of different struggles that we're juggling with COVID. And overall, these same public health actions that keep the public safe can make us feel isolated or lonely, because we might get bored of the same routine and we might feel stuck. So mental health services with COVID-19 have had a huge decline. 93% of countries have experienced disruptions in these services due to COVID-19. And that's mainly because before the pandemic, only 2% of national health budgets were spent on mental health. Fortunately, 89% of countries have reported that mental health is part of their COVID-19 response plan. So hopefully COVID-19 has really demonstrated to countries around the world that mental health shouldn't be overlooked, and it's something that we do have to prioritize in the coming years, especially in recovering from COVID. So now we're going to go into different ways that you might be able to take care of your mental health, especially during these times. So let's first review some of our common unhealthy outlets. So the first one is overeating. This is caused largely by a stress hormone called cortisol. And although it leads to temporary relief, long term, it causes a lot of discomfort and fatigue. Another common one is binge watching. Again, just like overeating, it's temporary relief, but long term leads to guilt or regret. Social isolation has become extremely more common this past year or so, but engaging with others will benefit our psychological, emotional, and as we mentioned before, even our physical health. And finally, drug or alcohol abuse interferes with our central nervous system. And this is especially concerning for teenagers who are still developing their bodies. So if we do refer to drug or alcohol abuse, it will lead to long-term medical problems that will continue to affect our development. So instead, we should practice a few healthy alternatives instead. First of all, we can practice intuitive eating, which is basing your eating choices off of natural hunger signals instead of binge eating. You can also try to join support groups or find someone that you can reliably confide in, because again, that connection with other people, just sharing what you're feeling, is very beneficial to all forms of health. You can even try to just leave your house for even 5 minutes a day, of course, practicing social distancing, because it can be very healthy for your mind. For binge watching, you can try to reduce the amount of episodes that you watch in one sitting, or do something in between them, like talking to a friend, because once again, that sort of social interaction, even virtually, not necessarily face to face, it can be very healthy. So some other healthy habits you can have. So over the short-term goals, you can try to think more positive thoughts, like affirmation and different mindfulness practices. You can begin exercising even for 5 minutes a day. This doesn't have to necessarily be really heavy, even just stretches when you get up, or taking a walk every day, or even meditating. Those can also be healthy forms of exercise. You can finally, you can find time to do some of the things you can enjoy. This can include reading a book or chatting with a friend, or just any hobbies that you have, even like playing video games. As long as it helps you, then it'll help your mind.
I think the biggest thing to remember is that you're not alone. As we mentioned, 1 in 4 adults go through this. So it's not uncommon. And I think the biggest thing to do is to raise awareness about this. It's very widespread, it's an issue that's everywhere. And that's why we're trying to address it. We're trying to raise awareness about it.
Yeah, exactly. We can't overlook these concerns. And more long term, you can try and get a good night's sleep, which I know people underestimate, but it is really important to be consistent. And if you are struggling with this, you need to try and gradually try to sleep earlier, just slowly push that up. Because if you sleep 8 hours a day, or however long you should, you will see a difference in your mental health. You can also try to pick up a hobby, especially with a lot of the more free time that we have now. This will keep your brain active and allow you to focus on something. It might also help you explore some new interests. And finally, you can reduce your screen time. Even though everything is virtual now, you do want to try and find opportunities where you are not necessarily looking at your phone. This will improve sleep, which goes back to getting a healthy night's rest. Also reduce your headaches and eye strain, which can, again, affect your physical health.
So just to add on to Laura, this would definitely be difficult at first, and I think it would have to start small. You want to start with small changes in your life and gradually make them bigger, but if you can make small changes, they can have a ripple effect and help your mental health. And it'll be difficult at first, but it will be worth it. So be gentle with yourself. Start small. Don't make these huge goals that are unachievable. Start smaller.
Yeah. So some other resources that you can look at, there are tons of hotlines available if you do need assistance, including the National Alliance on Mental Illness and also Substance Abuse and Mental Health Administration. If you're looking for more immediate services, you can begin by visiting your primary care provider to discuss any concerns you may have about your mental health, and may possibly even treatments, which can range anywhere from therapy to medication. If you need information on affordable healthcare, you can visit the HRSA, the Health Resources and Services Administration, or you can just learn more information on tons of reputable sites, including the National Institute of Mental Health. On a more national scale, there are tons of organizations dedicated to raising awareness and also helping anyone that needs assistance, including the Anxiety and Depression Association, the Mental Health America, and the National Alliance on Mental Illness. But again, if you are ever in immediate danger, please do not hesitate to call 911. So like we said before, the most important thing is to just believe in yourself. You got this. You're not alone. Also, always keep your mental health in mind, especially during COVID-19. You want to be wary of the different symptoms you may have of different mental health disorders and try to incorporate healthy coping habits.